My name is Kafengye Israili. I work for an organization called Scope Access Club, found in Western Uganda, and it deals in it is an organization for people living with HIV and AIDS, and especially women. And the work we do is to mobilize our fellow people who have tested positive so that they can come out and access treatment. But basically, at times treatment is found at the health centers, but there are challenges that hinder people from getting that treatment. Like people you find, most especially women, they lack transport because the communities are in rural areas, and you find it's above 10 kilometers to the health center, and it becomes a challenge for them. And even on top of that, being weak when they are weak, and most of them are widows, you find they don't even have food in their families, which affect their adherence to drugs. Of recent, we are implementing a program about PMTCT, and most of the challenges we have encountered amongst the women that it is a good program. Prevention of mother-child transmission is a good program to them, but at times it fails, mainly because, as I said earlier, because of lack of transport health centers, stigma and discrimination, lack of equipment to use during delivery, because usually when they go to health centers, they are required to bring what we call mama kits, and you find at times people are very poor to afford them, which makes them fail to go back to deliver, and they end up delivering in the communities where it undermines the program of elimination of child transmission. Me personally, I think I wouldn't be talking now if it was not for the Global Fund, because I actually have been with the HIV for about 20 years now, and at one time I had AIDS, and I was working, and I was taken home to die. But when I was still on my deathbed, I heard that the drugs had gone down. I had to sell my property and start drugs, which were at a cost by that time, but very affordable, somehow affordable. Then later, I started getting treatment for free. I had no children by then because my children had died of HIV. I managed to get a partner and got other children who went through PMTCT. And that's why, for example, I'm putting a lot of effort in making sure that other women, other people who wish to have children can get them free of HIV. But the only challenge, like I've mentioned above, is the one which is undermining poverty and lack of transport, and at times stockouts of drugs at health centers is undermining those programs.